Do you think that the present coronavirus pandemic might be moving a lot more people toward your platform when it comes to universal health care? Because it clearly shows that we need a national response to health emergencies. That right now what we're doing is reaping some sort of foul harvest of the political complacency of the last 40 or 50 years.
We have been told over and over again how effective and how wonderful the employer-based health insurance program is. Well, you know what? I think many millions of people in the last few weeks have begun to doubt that, because when they lose their jobs, not only are they losing their income, they are losing their health care. You have a good employer, you have good health insurance. Your employer is not providing good health insurance, you're screwed. So I think what this pandemic has done, and certainly in terms of healthcare, is make people understand that healthcare is not a privilege, it's not an employee benefit, it is a human right.
I would go you one further and say that healthcare is not just a human right, but it's actually good for the general welfare, because the people of means who do have health insurance and can stay in right now and not take too much of a financial hit are the ones who can do the right thing that we all know to do, which is to stay home. But if you don't have healthcare, if you can't stay home, you will spread the disease. This is about the entire society being benefited by every single person in it having what they need.
Not only are you right on that point, we're the only major country on earth that doesn't provide paid family and medical leave. Let's underline this a dozen times. When we talk about essential people now, we're not talking about hedge fund operators. We're not talking about necessarily the CEOs of large corporations. We're talking about doctors, and we're talking about nurses, and we're talking about grocery store workers, people who are keeping our society going. If people who are sick, who God forbid have the virus, and they're going out in the world, they're going to be spreading it. So I think in healthcare, there is an understanding that if you get sick, I get sick. If you got the virus, I get the virus if you're in contact with me.
If any good can come out of this terrible situation, it should be an awareness by average Americans that they are essential and that the elites and the richest among us do not actually have to go out and do their jobs right now.
Team, subscribe for more of these type of videos.